Welcome back to Mayo Clinic Radio. I'm Dr. Sanj Kakar.
And I'm Tracy McRae.
Attention Deficit Hyperactivity Disorder, commonly known as ADHD, is a chronic condition that affects millions of children and often continues into adulthood. ADHD includes a combination of persistent problems such as difficulty sustaining attention, hyperactivity, and impulsive behavior.
While treatment won't cure ADHD, it can help a great deal with the symptoms. Here to discuss is Mayo Clinic Pediatrician Dr. Rachel Lynch. Dr. Lynch is also part of the REACH Institute faculty. REACH prepares primary care providers to treat pediatric patients with mental health disorders in the primary care setting. Welcome to the program, Dr. Lynch.
Thank you. I'm very excited to be here.
So many parents talk about ADHD problems with their children every day, all of the time. I'm thrilled that you're here. How do you know when your child is ADHD issues, have those issues, or does not?
Yeah, so this is a tough question, and I end up talking with parents and families about this a lot. And I often tell them this is one of those things that we don't have a blood test for or an x-ray that tells us yes or no, you have ADHD or you do not. So it's tricky to figure it out sometimes. And what we try to do is get as much information as we can from a number of sources in the child's life. So that often means, or pretty much always means, talking with their teachers and finding out more from kids and parents what life is like at home. And we have to think really broadly about a lot of things that might be causing symptoms that look like ADHD, like things like sleep problems, or maybe a hearing problem is making it hard for them to pay attention in school, or a learning problem, or even things like anxiety, or in older kids, things like depression. So we have to think broadly and get a lot of information to figure it out.
What is the sleep problem? Just not enough time, not enough hours?
Yeah, so if kids definitely aren't laying down and sleeping early enough for the time they have to get up in the morning, that can be a problem. But even if they spend a lot of time in bed, but they're having snoring or breathing difficulties while they're sleeping, or they're really restless and kicking their legs around a lot, those could be things that are disrupting their sleep, and they wake up after a good amount of time in bed but not rested enough to focus and behave well during the day.
So, Dr. Lynch, we have a very young household, and our oldest, who's 4, will sometimes be pulled out from school and teachers saying, oh, he's acting out. Now, is that ADHD, or is it just that he's not being stimulated enough?
So it's a great question. So for kids that maybe aren't interested in what's being presented at the time because they've already learned this material, or maybe it's too hard for them and they're just not interested in it, they may choose to run about the room, or lay down on the floor. And until we know that this is really causing them, we always say impairment, but like it's making it hard for this child to get through their day, to do the things they need to do in their life at that time by having fun with friends and learning in specific environments. Until it's really clear it's causing impairment in more than one setting, we would not call it attention deficit hyperactivity disorder.
I thought that's just kids being kids.
Right? So often that's the case. And the younger kids are, the harder that is to sort out. So when they're 3 or 4, it's very difficult, and they need a lot of evaluation to figure out if that's really what's going on. As kids get older, it's a little easier to tell because we know what to expect from them developmentally as they get a little bit older.
Are there other conditions that go along with ADHD that can help you say, oh yeah, this might actually be something we should be looking into?
Yeah. So a lot of kids who have ADHD may have other things going on that we need to help figure out and see how we can help them. Many, if not most of kids with ADHD have normal intelligence, but some do also have a learning disorder. And so knowing those two things is really important when they're in the school setting, so we can help them as much as they can, or as much as we can. Anxiety can also go along with ADHD, and they can look similar. So it can take some time and a lot of information gathering to figure out, is one or both of these things going on, and which is the most important thing to treat. As kids get older, things like depression can also be happening, and even we worry about things like substance use as kids get older. Things like tics or brief abnormal movements, or obsessive compulsive disorder can also sometimes be present at the same time. So it's a lot to watch for.
It must be very hard then to diagnose because, as you said, there's a wide spectrum of these conditions and symptoms. So how do you actually make the diagnosis of ADHD?
Yeah. So there are different parts to making the diagnosis, and one is this information gathering. So we use, and it's recommended that standardized questionnaires are used that get completed by the teachers and parents. And there's a certain score that helps us see, is this something that we should likely be worried about? But it's not just the questionnaires themselves, or anybody that would be pretty straightforward, but it also involves a medical evaluation to make sure there aren't other medical causes that are causing similar symptoms, and a good psychosocial evaluation, the family history. We take all these clues together to help us figure it out.
Do kids this is why I'm even asking this. Do kids outgrow it, says the person who I never did.
Yeah, so that is a great question. I think most parents, we're trying to figure this out with their children, and especially if we say your child has ADHD, that's one of the first things they want to know, is this going to get better? And we keep saying ADHD, so part of that is the attention deficit disorder, and a part of that is a hyperactivity disorder. And the hyperactivity definitely tends to get better for kids that have this diagnosis. And overall, the attention and the hyperactivity aspects get better for most kids, to the point that about 2/3 of them are not really impaired as they get older into adulthood and needing treatment. But there is a remaining, a third or so of children who get this diagnosis that into adulthood do need treatments or really good strategies to overcome an attention deficit.
Or go into a career of radio. It works out so well.
Yeah, there are many careers where it can work out quite well. And part of the trick is figuring that out and helping your child and adolescent figure that out.
Tell us about the Reach Institute.
So the Reach Institute is something I've been a part of for about 5 or 6 years. And I was thrilled to learn about it as a learner. So I got to attend a course where they were teaching primary care providers about mental health concerns in primary care. And I really went to the course to learn about it because of the ADHD work that I was doing, and realized I really need to be even better at identifying anxiety and other mental health disorders. And so I took the course, and they were really looking for more primary care providers to kind of be the messengers or teachers to help people understand we can really help kids and families more who are suffering and struggling with mental health illnesses. So now I've been part of the teaching faculty there, and I get to teach in exciting places. I just taught in Palo Alto, California, and it's just always, it inspires me a lot to see other people who want to come and learn because they're seeing these concerns in their clinics. And it's wonderful to be able to help and have that impact on children and families as we help other providers.
We've been talking about attention deficit hyperactivity disorder with Mayo Clinic pediatrician Dr. Rachel Lynch. Thanks so much for joining us, Dr. Lynch.
Thanks.